today's topic is most important for your clinics. What we will tell today, you may not remember everything, but once you go to the clinic and practice the things, you will remember. These things, you will memorize everything while practicing. When you examine a baby and do the developmental assessment, then only you will learn these things. Okay? What is the difference between growth and development? Anybody can tell? Growth and difference between growth and development? What is your name? Ishika. What is the difference between growth and development? Growth is increase in size due to cell division. Okay? Due to there is a multiplication of cell, there is size, increase in size. So newborn or when baby is inside the womb, uterus, this one unicellular tube becomes a human being. So it is a change in size, and development is maturation of function. Maturation of function of the organs, mainly CNS. This is development because there is a myelination of CNS. Then the skill, development of skill of the organ, that is development. So there is a difference, is there growth and development. Now, there are some rules which follow in development. Number one, development is a continuous process, begins in utero and progressing till maturity. Development starts from uterus. Sequence of attainment of milestone is essentially same in all children. Sequential of milestone is at the age of sitting. Anybody from this age group will sit in same age group, age. Development proceeds in cephalocaudal direction. Then I will tell you later what is cephalocaudal direction. Means development starts control of head first. After then goes to the body, their trunk, then to the limbs. Means is a cephalocaudal direction. Okay? Trunk control, then proceeds limb control. Control of limbs is proximodistal, means proximal part of the limb, they develop first, then the distal part. That's why fine motor develops little later. Fine motor develops, gross motor develops earlier, fine motor develops later. Proximal, proximodistal. Control of limb proximal. Certain primitive reflexes to be lost before appropriate milestone is achieved. See, in newborn baby, there is so many primitive reflexes are there. Suppose a baby starts first holding an object by ulnar side, it is called ulnar grasp, screwed grasp. So ultimately he develops fine proper grasp, adult grasp. That before developing adult grasp, this ulnar grasp has to be abolished, and then he will not develop the mature grasp. Okay? Understand my point? Initial disorganized mass activity is gradually replaced by more specific activity. Understand my point? This is the most vital point you should remember, developmental rules. Example, when show a bright toy 3 months old baby, if 3 month baby, if you show some bright thing, he suddenly excited, he will become excited, isn't it? But when you show it 3 to 4 years baby, he will smile and he will ask for it. That is maturity. He has developed some maturity. That is the gross disorganized mass activity is lost. Now, developmental domain. There are so many domains of development. Number one, gross motor, fine motor, personal and social development and general understanding, language, vision and hearing. These are the domains of development. Understand? So, today we will discuss gross motor and fine motor. Remaining 3 will be discussed in next class. It will be difficult to finish in one class. Okay? Domains of development determinants. Motor, cognitive, language and social domains mature concurrently. Understand? So when you examine a baby for developmental assessment, don't examine only motor. Examine others also. In this age group, what should be the language, what should be the social everything you have to because developmental delay, maybe one domain may be affected, 2 domains may be affected. That is called a gross developmental delay. Early life experiences nutrition and environment modulate the neural activity, circularity. It means early life experience. Nutrition of the baby. Suppose intra-uterine any problem mother had, at the time of delivery mother had, whether baby received kangaroo mother or not, whether baby got breastfeeding or not, natal any problem, all these things will influence the development. Even nutrition of the baby. Education of the mother, most important, family education, stimulation to the baby. A baby born in a good educated parent family, they will stimulate their babies nicely. Then this baby will become more intellectual. Yes, because development of brain, it starts from womb to up to 5 years of age, mainly up to 2 years of age. From womb it starts developing. That's why care in the mother is most important in antenatal care. And that is another important thing is natal care, then postnatal care. So many genetic diseases influences the development. So early life experiences, nutrition, environment modulate development. Protective factors like stimulation, maternal education can offset the biological risk. So there is a graph I have shown you. Upper one is the normal birth development. The below one is some risk factor is there in the development, like in the form of natal insult, maybe genetic disease, maybe anything. Environmental factor. This is red one. In between this, if you intervene in this red area, then he will improve little bit. He may not be the part of the normal, but he will improve, little bit improvement will there. That's why early recognition is most important. Early recognition will help to intervene early, then the outcome will be little better. Now, gross motor development starts seeing pulling to sit baby. If you hold the baby and try to pull the baby, gently, pull. See, at birth up to 8 weeks, if you pull the baby, there is a head leg. There is a head leg. That is called head leg. This is called head leg. This is head leg. Okay? At 4 months, there is a partial control of head. He is controlling his head in the straight line. Understand? At 5 months, he can hold his head nicely, even flex. Understand? This is the 5-month development. So you should remember this while examining the development of a baby. This is the most important thing. See, at 5 months, he had some efficiency to see his legs. You will see newborn babies, they are pulling their leg to the mouth. That is the thing at 5 months of age. That is called head control pull to sit series. Okay? Then you do the ventral, this is called ventral suspension. You do the ventral suspension. Hold the baby below chest and abdomen. You understand my point? At 4 weeks, there is dropping of head, like this you will find. At 4 weeks. Understand? If you see 8 weeks, head is horizontal. Here head is dropped. Here head is horizontal. Here a 45 degree, so it's a little bit raised. Understand? At 12 weeks, above horizontal. Above horizontal. Isn't it? These two, you remember, I'll show you, I'll tell you later, these two. So tone evolves from physiological flexor dominance to balanced tone. In ventral suspension, the infant progressively lifts head and trunk by 12 weeks. See, by 12 weeks. That will tell later. These two picture, then comes prone position. After ventral suspension, you do the prone position. If you prone position, if you see, this is the prone position, okay? Here, if you make the baby prone position, at 2 weeks, baby will lie like this. He will turn his head one side and flex his limbs toward below abdomen. This is normal for 2 weeks. But at 6 weeks, he will like this. He will straighten his pelvis. So if baby can straighten his pelvis, you can assess that this baby's developmental age is 6 weeks. If baby's age is 6 weeks, mother tells them that yes, chronologically 6 years, then it's normal development. Understand? In this way you will assess. Understand my point? At 3 months, he raises his hand. See, he is still lying in the bed. But he raises his hand, head little bit, 45 degree. At 3 months, baby. Understand my point? 3 months, 2 months, 8 weeks. At 12 weeks, he can bear his weight with the hand. Understand? At 6 months, he can raise his trunk like this. So if you have to remember this, how will you remember? How will you remember? Only thing while practicing, when you go to the clinical classes, don't be like this, you are missing. Your best always misses classes, don't attend classes. If you don't miss classes, go to the clinical classes. If you examine a newborn in this way, then you will remember. But it will be very difficult to remember in one day. You have to repeatedly, you have to read. Then baby starts crawling. Crawling, have you seen? That is not crawling. This picture is not crawl. This picture is not crawling. He raises. Yet a baby moves, keeping his abdomen attached with the floor. He doesn't raise. That is called crawling. So at 6 months, a 6 month baby starts crawling. But that is called creeping. Creeping. At 10 months, baby starts creeping means he raises his abdomen from the floor. That is called creeping. So 10 months is creeping. It is a bear of walking. At 12 months, baby starts doing this. You understand? So creeping appears around 10 months, bear walking at 12 months, and clinical significance quality of crawling predicts later balance and spinal coordination. If there is any motor problem, neural problem, there will be difficulty in doing bear walking. He will not be able to move his one hand or one leg. You will find some difficulties. Isn't it? In this way you can assess whether he is doing this or not, or there is some difficulty. 2 years boy cannot do this bear walking, then this is a developmental delay. Understand my point? Then comes sitting. Then examine for sitting. Initially, at 8 weeks, if you start baby to sit, baby will sit, but there will be rounding of the back. Back will not be straight. You understand? At 4 months, baby starts sitting with straight back. Okay? At 6 months, baby starts sits with support. What is the support? This is the hand. With hand is giving support. This is called sitting with support at 6 months of age. That is called tripod position. Tripod position. Okay? 8 month baby can independently sit. This is independently sitting at 8 months. So, sitting with support 6 months, most important you should remember it. Independent at 8 months. This is called pivoting at 11 months. He is seeing some object in sitting position, you want to take it. So, this is called pivoting. This is the most important steps you should remember while assessing motor development assessment, sitting. Then comes standing milestone. See, at 6-month baby, small baby, if you make to walk, he will stand, he will stand. He will bounce his legs. You have to support the baby, he will stand. He will bounce his legs. And then 9-month baby can pull to stand. After holding something, he will pull himself to stand. Understand? At 10 to 11-month baby, he will cruise sideways with support. Means he will move around, holding the support, he will move around. Understand my point? At 12 months, he will stand without support. At 12 months, he will stand without support. These you should remember again. At what stage he can pull to stand, at cruise at what age, at what age he can stand without support. At 1 year or 1 year to 13 months, he will walk holding one hand. Understand? "15 months, independently he will walk. 13 to 15 months, independently he will walk. 18 months, he will run, he will squat. ठीक है? And in that age, he can climb the stair by crawling. He can climb the stair with crawling. 18 months. 4 years ascent stair with alternate feet. See, he is walking at 4 years, alternate feet. But 2 years age, he can climb the stair with 2 feet in one stair. In 2 feet in one stair, 2 years of age. But 4 years, he can alternate feet, he can walk. ठीक है ना? That is called, what is this? Hoop. You hoop at 4 years of age. So, this is the gross motor milestone summary. 3 months, neck holding. This you should remember always. 5 months, rollover. 6 months, rollover means at 5 months, you will roll from supine to side, ultimately from supine to abdomen. He will roll over. 6 months, sit in tripod fashion. 8 months, sitting without support. 9 months, stand holding one support. 12 months, creeps well, walk but fails, stands without support. 15 months, walk alone, creeps upstairs. 18 months, runs, explodes drawers. 2 years, walk up and down, 2 steps in per feet, I have told you. And he can jump at that time. A 2 years old boy can jump also. At 3 years, he runs to ride tricycle. He learns tricycle at 3 years. He alternate feet going upstairs in 3 years. 4 years, hope on 1 foot, alternate foot going downstairs. 5 years, baby skips. Skipping comes at 5 years. You remember this chart. This is a gross chart you should remember for evaluating any baby for motor. This will help you. Understand? Any query? Any problem? Any problem? Motor? Then we come to the fine motor. Fine motor means deals with hand and eye coordination. Head and eye coordination. Hand and eye. If you see the newborn, you will see there is always he keeps fist in the hand. If you see the newborn, by 2 to 3 months, fist will go. There is a cortical thumb. Newborn, if you see the hand, you will see there he is keeping his thumb towards the ear. palm. This is called cortical thumb. This also will go by 2 to 3 months. If it doesn't go, it is a pathological. He has some CNS problem. So this is the early sign, these things, cortical thumb, feasting, persistence of feast, you should see it. Then comes hand regard. Every baby, by 12 to 20 weeks of age, they will have hand regard, means he want to see his hands. This 5 months, what I told you, he wants to pull his leg in his mouth, bring leg up. Here at 12 to 20 weeks, what is there? Hand regard. Even a blind child will have hand regard. Persistence of hand regard beyond 20 weeks is pathological. Understand my point? Then 3 to 4 months, he will bring his hand in midline and will play like this. Clinical note, any asymmetry or absent hand regard may suggest visual or motor impairment. Okay? If you put some dazzling thing before his eye, he will see it attentively. At 4 months, he will try to hold the ring and will try to bring it in mouth. Initially, he may not reach the object. There will be overshooting. Gradually, he will be able to hold. That's why we tell always to keep one baby, newborn baby, 2 or 3 months old. We always tell my parents to keep some ring or this, what you tell, the ornaments like red color or to put hanging in front of him. The visual fixation hoga iska. So fixation on moving ring at 4 months reflects visual tracking. By dexterous reaching mark cortical and cerebral coordination. Because he will not be able to do that if his cerebellum and cortex doesn't function properly. Coordination between eye and hands matures before true grasping begins. This develops before grasping reflex develops. Understand? Then you have to evaluate for grasp. For the grasp, what you have to get, you have to get cubes. This type of cubes with you, 1 inch by 1 inch by 1 inch. Make it color. When you go for the class, you should have some cubes with you always. Otherwise, you will not be able to test. Understand? That is mandatory for all of you. So, pediatric clinics is different than adult. I am telling always you people. You should come with so many things. One is cubes. So, if you give some cube, he will try to hold, but he will not be able to hold like mature hold, grasp. That will be immature. First is palmar grasp. See, this side is palmar side. Which one is palmar side? This side. It is palmar side. Or this is palmar side. Which one is palmar side? This one. This is radial. Understand? So, he is holding the object towards the ulnar side. His radial side is free. Isn't it? That is called palmar grasp. At 6 months, there is a palmar grasp. At 8 to 9 months, he can hold the thing in his palm. That is called crude intermediate grasp. At 10 months, there is radial, I didn't have picture, I think. At 10 months, there is crude radial grafts at 10 months. So ulnar come first, then radial. Ulnar at 6 months, radial at 10 months. Understand? In 1 year, mature grafts. See mature grafts. He is holding the object with fingers, thumb and index finger. This is mature grafts. ठीक है? Immature pincer grafts. Pincer, it is most important again, 10 months. Immature pincer graft, 10 months. With the finger, immaturely he is holding, somehow he is holding. He is not using the tip of the index finger and thumb, he is not using. Graft, crudely he is holding it. That is called immature pincer graft. This is most important. You have to keep some pellet-like thing with you and give it to the baby, a 10-month baby, whether he should be little colored so that it attracts him, and you see whether he is holding it properly or not. The pincer graft case ho raha hai, aise dekhna hai. So you have to practice it in the word. Today you are reading, and if you don't practice, you will forget. I am telling you, it will become useless. And 1 year, mature pincer grafts. Means by tip he is holding. So this is immature pincer graft, this is mature graft. ठीक है? There is searching for drop object at 9 months. At 9 months, if you find some color, something in front of him, he will search. ठीक है? Or poking with index finger at 9 to 10 months. All are fine. Understand? You will get in book. Don't worry. That is called mouthing and oral motor skill. कि देखा आप लोग ने कोई छोटा बच्चा कुछ खाना वाना दिया है बहुत है खाना वाना दिया खाने के लिए ले रहा है देखा आपने कभी because by 6 months he has developed ulnar grafts, isn't it? Ulnar grafts 6 months I've told you. Then he can grasp, maybe it is crude, he can grasp. He will put the thing in his mouth. So, chota bacha, you will see everything he puts in the mouth. See his mouthing. This is called mouthing. Oral and motor skill. Mouthing object and chewing discourse 6 months. Okay? If mouthing is present after 2 years, there is some developmental delay. So we want to see mouthing, but we also don't want to see mouthing after 2 years. Understand my point? So at 6-7 months, baby doing mouthing, we are happy, his development is normal. But at 3 years of boy doing mouthing, it is abnormal. So you should remember this. This behavior integrates feeding and exploration. Self-feeding. At 12 months, baby can drink water or milk from a cup. He will try to drink. But with spilling. At the time, he will not be able to drink. There will be spillage. Month of boy, age, he will drink without spilling. Understand my point? At 2 years, nearing 2 years, 18 months to 2 years, he can feed himself with spoon. That also part. You have to, when you ask history to the mother, developmental history, कुछ बोला ना जो pediatrics में clinics की हम बोला, you have to take developmental history. I told you that history you should take. age देख लिया, उसका बच्चे का उम्र कितना है? मेरे बच्चे का उम्र 18 months, 19. That time you have to think 18 months में feeding में क्या होना चाहिए? तो चामच से खाना चाहिए. Whether he is taking with spoon or not, that is still to take. This delay may be for what? Suppose baby is not taking with spoon. What could be the cause? What I told you at the very beginning, this graph I have shown you, stimulation is one of the positive factors. Mother may be uneducated, not teaching the baby. From very poor family, uneducated family, poor socioeconomic condition, not teaching my baby properly. It needs stimulation. Or it may be due to some CNS disease. You understand my point? So in this way we will assess. The bachcha ko kyun nahi ho raha hai? You have to think in that line. Understand my point? So all these things having clinical significance. See, at किताब का पेज बच्चा उल्टाते हैं. At 15th month to 18th month he can 2 pages. He scribbles, he unscrew leads at 15 months of age. They require bimanual coordination and problem solving ability. See, can you see? This is yeah. At 3 years, he can circle. At 4 years, he can give plus sign. 4.5 years, he can draw the square. At 5 years, he can draw the triangle like this. 6 years, 7 years like this. 8 years, he can draw like this. 9 years, he can draw like this. 10 years, he can draw like this. So this you have to test. As per age, बच्चा क्या कर रहा है? You have to test in a paper. Suppose बच्चे का उम्र 5 साल. So you ask him to draw a triangle. Whether he can draw triangle or not. 5 साल का बच्चा triangle रखना चाहिए. You have to ask the baby to draw the triangle, whether he can draw or not. Understand? This is the way you are assessing the development. So you should know this table. At what age, what he can draw. Accordingly, you ask to do this task, to assess the development. Understand? See here, I cannot see. At 15 months, he can 2 cubes, he can do like this, 15 months. At 2 years, he can make with cubes strain. Have you seen how to make? That's why I told you, you have to come with cubes in your pocket. When you come to the pediatric clinics, you have to test. A 2 years boy, give you a cube, ask him to make a toy, train like this with cube. See, at 2.5 years, train with chimney. This chimney, whether he can make or not. At 3 years, he can make breeze. Understand? So you have to remember this. At 4 years, gate. Tower of 9 cubes at 3 years. Steps at 6 years. Like this, you will make steps at 6 years of age. So accordingly, as per age, you ask him to make this a tower or steps or bridge or gate, anything as per his age. You have to ask. Understand my point? So you have to know this one also. This chart also you should remember. This one also you should remember. If you become pediatrician, how many of you want to be pediatrician in life? जो pediatrician होना चाहिए, उसको he should remember till death. Till death. ठीक है? If you are becoming surgeon or physician or something gynecologist, you may not remember, but you have to remember till pass. But those who want to become a pediatrician, you should remember these things till death. That is your bread and butter. You should remember it. So, fine motor milestone table. This is the fine motor milestone table. Age 4 months, bidextrous reaching out of objects with both hands. 6 months, unidextrous reach. Unidextrous means with one hand. Reaching out of objects with one hand, transfer object. 9 months, immature pincer grip, probes with 4 fingers. 12 months, mature pincer grip. 15 months, imitates scribbling, tower of 2 blocks. 18 months, scribbles, tower of 3 blocks. 2 years, tower of 6 blocks, vertical and circular stroke. 3 years, tower of 9 blocks, copies circle. 4 years, bridge with blocks. Copies cross. 5 years, copies triangle, gate with block. You should remember this chart. This which one chart? This chart you should remember. While testing, examining the development, you should check in this way. So, screening scheme of developmental upper age for age at 3 months, gross motor is supports weight on forearm, open hands spontaneously. I told you by 2 or 3 months hand will open. Sits momentarily 6 months, stress per object. I am not going social and language. 9 pulls to stand, pincer grip. Fine motor में क्या होगा? 12 months works with one hand held, release an object on command. 18 months works upstairs with assistance, feeds self from spoon. 24 months runs, builds a tower of 6 blocks. That is the when you assess a baby for development in this way. Gross motor क्या है, fine motor क्या है, social skill क्या है, language क्या है, ऐसे करके इसको develop examine करना होगा separately. Understand my point? Then you tell his motor development is 6 months, his fine motor development is also 6 months, language development is also 6 months, social also 6 months, so his development is normal. Understand how to tell in exam? If your development is as per age, all these domains are normal, then tell normal that. But without examining, if you tell normal, then you will be caught in the class. Examination here. This is not for you. Oh, there are some tools that are used for development screening. Trivandrum development screening test is there. Geneva development screening is there. Baroda developmental is there. This helps in domains assessed. Trivandrum में gross motor, fine motor, vision, hearing. These are the things that examine. This you should read from the book. So integration and clinical application. Motor skill develops in cephalocaudal and proximal order. Early recognition of delay allows neurodevelopmental intervention. Always compare motor domains with cognitive and social. Gross motor, large muscle controls movement, balance. Fine motor, small muscles coordination, grasp and writing. Both reflex CNS maturity are essential for screening and counseling. Most important thing. This is not seen properly. This is not seen properly. See, red side, some. This is not important. Now it's important. Can you see it? Can you see? This is there in the guy. Means the age, at what age you should attain what? You should know. Means nothing else. You should know at what age what should be there. Accordingly, you have to assess. This slide I have told you. एज क्या क्या होना चाहिए, ये हो रहा है क्या? ठीक है, थैंक यू.